facility is a place for them to come in and potentially use substances there, but also access other services. So it's a super controversial intervention,
no doubt.
And the first of its kind. And my role as an anthropologist is to consider the politics of community participation. So to consider the ways that public health advocates or practitioners in this consortium involve local community members, what things that they're attending to as they plan a public health intervention that's really geared towards a specific demographic. And so my role is to really kind of take account of how local context plays a role in how this intervention is being designed and implemented. It's going to be in San Francisco, and so the consortium is working specifically in San Francisco's Tenderloin district, where there's a high concentration of substance abuse, and where it really has become a community issue, the issue of public injection, trying to consider innovative ways to handle substance abuse issues. Well, it'll be a qualitative project, and so I am going to approach it ethnographically. And so my role really is to work with three main kind of populations. And so the first one would be the advocates, the public health intervention planners that are coming together to work on this project. The second community is the quote-unquote user community. And so this is another kind of problematic, category that comes up in terms of trying to figure out how to access populations that are really stakeholders in the project. Mm-hmm. And then I'm also working in the policy context to figure out ways in which really harm reduction health interventions have been pushed kind of within a broader context of a harm reduction health movement, both in San Francisco, nationally, and kind of globally. I facilitated a bunch of women's health groups and just general social support groups. And I also did street outreach, so went around these same neighborhoods in San Francisco, the Tenderloin and the Mission District, and did outreach to women substance users who were an underserved population and who had trouble accessing services. And so I was kind of the point of contact between the agency and women who were street-based drug users. The Department of Anthropology has an excellent reputation for being a department that focuses a lot on theory and the ways that theory can then be applied in interesting ways in anthropology. And so really Louise Lamphere was a big pull for me. She has an excellent record as a feminist anthropologist and also as someone working in policy, really blending issues of policy and anthropology. And so she was a big pull. And then also I was able to come here for my first year because I was offered through the department a one-year fellowship. And so if it hadn't been for that initial offer, I don't know that I would have been able to come given that I was so far away at the time. Well, I think that one of the incredible things is that this fellowship has really allowed me to really pursue a career in medical anthropology, which is something that was more a dream that I'd always had, but I wasn't sure that this department was necessarily going to be able to give it to me. I knew I'd be able to do maybe the anthropology of health, but really being trained as a medical anthropologist has come from this center specifically. And so it's really enhanced my entire program in anthropology in terms of giving me a whole realm of other scholars to access. So people from the School of Medicine and other departments that I never would have had these connections facilitated with otherwise. I've also been able to learn a bunch of quantitative research methods, which is not a focus of our department, but something that you very much need if you're going to be pursuing health policy work. And so that's something that the center has helped me to facilitate. Over the summer, I was able to start quantitative data analysis courses, and I'm continuing them through this semester and probably will go on with statistical stuff because otherwise approaching the health literature is impossible without that knowledge, and it was something that I was lacking from my own home department. So that's been a huge that's been major for me just in terms of really being able to keep up with these discussions and to hold my own in these discussions that are largely quantitative. I think really what even just that microcosm of substance use in that specific context, what it really speaks to is just more of a broader dedication of mine to addressing health disparities and really structural inequalities that lead to health disparities. And so I think that is my broader interest. Like I said, I'm from El Paso, Texas, and the border region is historically underserved, and people are historically sicker at the border, and there's more health, environmental issues that are ongoing. And so I think really all of that informs my broader interest in health disparities and structural inequalities that create the climate for disparities. Well, part of me would like to teach, but I also now see myself with my work at the center being more research-oriented. And so I would love to work at a research center, whether it be in the Bay Area or locally. Like I said, I'm working with Katie Wilking on her project out of the Behavioral Health Research Center of the Southwest. And I would love to pursue nationally funded research if possible. And also as part of these multidisciplinary teams, because I think qualitative methods as they stand alone are not as strong, of course, as these teams of multi-method approaches. So I would love to work on a multi-method kind of team, research team.